What is a blepharoplasty procedure and who is a good candidate? I'm Dr. Cohen with the Cohen Clinic, and I want to take a second to talk a little bit about eyelid surgery. That's what blepharoplasty means. We're doing a procedure for your eyelids to make them appear more rejuvenated. Now, the upper eyelid ages typically with skin excess. So some people comment they can't wear makeup the way they normally used to, or they're feeling like they're getting some heaviness or hooding of the skin here in the upper eyelid. That is very easily addressed with skin removal, conservative skin removal, and then a little bit of some fat sculpting, whether we're taking away a little bit of fat from the inner corner here or repositioning it. It's important that we not over sculpt the upper eyelid. That's a very old school traditional technique which can leave the eye actually looking more hollow and a little bit older. So it needs to be done appropriately. We joke that the upper lids are kind of like dipping your pinky toe into the ocean of cosmetic surgery because it's usually very accessible. The recovery tends to be achievable and manageable. There's stitches there that live for about a week, and bruising and swelling can be minimal. So that is the upper lids. The lower eyelids age very differently. The lower lids age via contour change. So we're looking at the anatomy here. Everyone understands under eye bags. Everyone hates under eye bags. What that is, it's normal eye fat that lives here in the eye socket. It's protecting the eyeball. And as we get older, the retaining wall that lives here and kind of holds that fat into the eye socket tends to thin out and weaken with time. And the eye is getting pulled down with gravity. The fat has nowhere to go in the eye socket, so it gets pushed out. That's what creates the hill, this bag here that everyone hates. And then we combine that with a lack of volume here in the cheek. We're losing fat as we get older. That fat, the remaining fat, is falling down with gravity, and you get a valley right next to a hill. And that creates shadows. Shadows create the appearance of under eye bags. So to improve on that, we need to do two things. We have to shrink down the hill and also fill the valley. And we can do that either through the skin, we can do that from behind the eyelid, which is my preferred technique. That way there's no scar. And we address the bag, we bring down the hill, we fill the valley either by tucking this fat down, or we can do fat grafting if we need more fat. So there's different options available, and these are things that are best discussed during a consultation, because that all comes down to your particular anatomy and your particular goals. So it's a very customizable procedure. If you want to learn more about this, please follow along. It's a procedure that we do very, very commonly and one that I enjoy talking about. So I hope this was helpful, and we'll talk to you soon.